Hello everyone and welcome to another edition of For the Health of It. I'm Lou Beccaria, your host for today, and so glad to have you with us once again. Our show today will cover the disease that is frequently and regretfully it affects too many people. This disease can have devastating effects for one's entire body, as well as significantly affecting one's quality of life and length of life. What I'm talking about is the disease of diabetes. Through our guest, Karen Spector, a registered nurse with the Community Health Education and Outreach Department at the Phoenixville Hospital, we'll be pointing out to you some of the causes, the signs, and the ways to manage this dreadful disease. So Karen, welcome to the show, and thanks for being back with us again. We always appreciate having you here.
Thanks, Lou. Thanks for including me.
So for our viewers who may not know you, tell us just a little bit about your background.
Well, I've been a nurse for countless years. We won't say how many. I've been involved with Phoenixville Hospital my entire career. I've landed a wonderful job now working with community health at the hospital, doing multiple outreach programs, facilitating support groups, teaching some classes, trying to learn a lot more about the diseases that affect us all.
Right. And you're a registered nurse and a BSN?
BSN, yes.
Mm-hmm. Good. Okay, well, let's just dive into it now. For those who may not be aware, what exactly is diabetes as a disease?
Diabetes is a chronic metabolic disorder. It affects so many people in so many ways. To put it in layman's terms, it basically affects the metabolism of protein, fat, and carbohydrates in our body. Typically, it's evidenced by high blood sugars in our body, which is controlled, the blood sugars in our body are controlled by the pancreas, and in diabetes, the pancreas doesn't function like it should.
Oh, okay. So the combination of those three things that you just mentioned, when they get out of whack, then, so to speak, in layman's terms, that really causes the diabetes
Correct.
to come to the fore.
Correct.
So are there different types of diabetes? I've heard of people refer to like type 1, type 2 diabetes. What's the difference?
We have three major classifications of diabetes. Type 1 is typically juvenile diabetes, although people as adults can get type 1 diabetic. Type 2 diabetes is the most common that affects most people, and gestational diabetes is a diabetes that affects pregnant women, typically their last trimester. Many times when they're gestational diabetics during pregnancy, later in life they go on to develop type 2 diabetics.
Oh, so which is the more serious of those three different types, would you say?
Well, they're all serious. Type 1 is always treated by insulin. Type 2 diabetes and gestational diabetes, we try to treat with diet first off to see if we can control without medications. Many times they lead to oral diabetic treatment and insulin in the end.
Okay. So what would be some of the symptoms that people might see or feel in their bodies about the development of diabetes, Karen?
Well, it's interesting. Many times people present to their eye doctors with blurry vision or visual problems, not relating that at all to diabetes. Many times the eye doctor will suggest that they get some diabetes workup. Blurred vision is usually a typical symptom of that. Many people have excessive thirst, drinking all the time, consequently urinating all the time. Mm-hmm. They also may feel real sluggish. When our blood sugars are high, it makes us feel sluggish, run down. Many people lose weight. Many people don't heal as well if they have an infection or a sore going on. And then all of that is a consequence of the blood sugars being out of whack.
Wow. So the blood sugar and the glucose that we have in our system really affects lots of different things.
Yes, it does.
In their daily functioning.
Yes, it does.
Wow.
There are some other different type diabetic classifications, but those are pretty rare and they're autoimmune disorders, so that's why I'm not going into that today.
Yeah. Can diabetes be lethal?
If not controlled, yes. Mm-hmm. Diabetes affects our entire body. Many people think it's just because of the blood sugar, it just affects blood sugar levels. It affects our eyes, it affects our nerves, it affects our heart, our vascular system, our kidneys. Wow. It's a total body system disease.
Well, when God created us, He really did a job of making sure everything was connected, didn't He?
Yes, He did. Yes, He did.
In America, we hear about diabetes a lot. So how many Americans are really affected by it? And are there more young people, children affected by it than we hear about?
I tell you what, Lou, the numbers are astounding. Currently, we have about 30 plus million people affected by diabetes. That translated would be about 9.4% of our population.
That's
On the
huge.
other hand, too, about 84 million of us are affected by what's called pre-diabetes. That's a diabetes we're not aware of. That affects 1 out of 3 people, children, teens, young adults, seniors.
So how is pre-diabetes diagnosed? Like, what would be some of the signs of that? Would they be different signs than for actual diabetes?
We don't really have a lot of signs of that. Typically, pre-diabetes is picked up on lab work through your family doctor, your internist. They do what's called a hemoglobin A1C, which is a measurement of how our glucose has been over the past 2 to 3 months. We have levels 5.7 to 6.4% qualifies us for pre-diabetes.
Okay, great. Well, Karen, we're going to need to take a break for commercial right now. And I'm talking with Karen Spector, a registered nurse at the Phoenixville Hospital's Department of Community Health Education and Outreach. And we're talking about diabetes, and when we come back, we're going to hear more from Karen Spector. So please stay with us. Hi, welcome back to For the Health of It. For those of you who are just tuning in, we have the pleasure today of talking with Karen Spector of Phoenixville Hospital's Community Health Education and Outreach Department, and we're talking about that dread disease of diabetes. So Karen, in this section, let's start off at least by talking about prevention. How do we prevent getting this disease, and is it preventable?
Prevention is key in so many of our diseases, Lou, but especially diabetes. We can get a hold on it, even as parents, as adults, by increasing our exercise. And I don't mean going to the gym 15 times a week. We suggest our people walk. Walking is a big key, a little bit after each meal, any snacks. We also encourage a healthier diet, one lower in carbohydrates, higher in fruits and vegetables, drinking water rather than fruit juices and sodas.
Why is walking so important, even at the minimal level that you were suggesting, if it can be therapeutic? But what is it about walking that is so therapeutic?
Walking helps metabolize our blood sugars. If we're just sitting after a meal, sitting after a snack, all our blood sugar has to do is sit there and elevate itself.
Okay.
With walking, it helps metabolize the sugars, helps bring it down. Even my pregnant women, I suggest, even though 9 months pregnant, it's hard to get out and do a heavy-duty walk, get up and walk, do the dishes, put the wash in, go up and down stairs. If people are confined to chairs or have some immobility issues, they can sit in their chairs and do some arm exercises. Everybody can do an increased form of exercise.
Okay. And how many times a week would you feel would be adequate, at least, at even a minimal level for people to get more exercise? It would be...
Did you want to hear daily?
Yeah, daily,
Yes,
sure.
yes. And like I said, it's not going to the gym and power working out on machines or heavy-duty treadmill. Everybody can increase their walking. It's a difficult time of year because of the weather. People can walk inside, go to the grocery store, go to the mall.
Okay. So there's always some way to do it.
Yes, there
and there's
is.
always at least a few minutes in every day.
And there's always an excuse why not to.
Okay. We'll try to avoid those excuses. So how is diabetes treated? What's the standard of practice for treating diabetes, Karen?
Type 1 diabetes is always treated by insulin. When a child, a baby, a juvenile is diagnosed with diabetes, they go right to the insulin injections. As older adults with type 2 and gestational diabetes, we try to go with diet first. We have people monitor their blood sugars with a glucometer, and based on the monitoring that and drawing the blood levels, we see if you're controlled with the diet alone. If you're not, we start with oral meds.
Okay.
After that, if it's not controlled with oral meds, we go to insulin.
Now, once someone is on insulin, can they eventually get off of it? Or is it once you're on it for the rest of your life?
Well, the type 1 diabetics are always going to be on insulin.
Can that be ratcheted down to type 2?
No.
No.
Once you're type 1, you're always type 1.
Okay.
Type 2, given a change in dietary habits, lifestyle changes, I have seen people come off insulin.
Wow. But it's not the norm, though.
No.
Not the norm. Are there specialists in the healthcare field that deal just with the diabetic condition?
Yes, typically you're diagnosed through your family practice doctor, through your pediatrician, through your obstetrician. And then some internists can monitor your blood sugars and treat it with that. Most of our diabetics, the type 1s, people that have had it for life, go to endocrinologists who are specialists in the diabetic disease.
Okay. And that's a big word, endocrinologist. What do they do in addition to diabetes?
They are specialists in the area. Like you have an orthopedic doctor specializes in bones. You have an obstetrician who specializes in women with pregnancy. An endocrinologist manages diabetes and other endocrine disorders of the blood.
I see. Okay, good. Now I know the department, it's there for education purposes. And actually, people may not know this, but we're one of the few community hospitals in this whole region that has such a department of community health education and outreach. So kudos to Phoenixville Hospital.
Thank you.
What kind of education do you actually do in programming to help people in the community?
Well, for diabetes itself, we offer a self-management program, a three-week program. People come once a week. That's for connecting with diabetic educator, nutritionist, and connecting with other people with diabetes.
Okay, we're going to take another break, Karen. We're going to be back for a third segment, everyone. Please stay with us, and when we come back, we'll hear more from Karen Spector, nurse at the Phoenixville Hospital's Community Health Education and Outreach Department, talking about diabetes. We'll be right back. Hi, welcome back everyone to For the Health of It. For those of you who are just tuning in, we have the pleasure today of talking with Karen Spector from Phoenixville Hospital's Community Health Education and Outreach Department about diabetes, the dreadful disease of diabetes. So, is there a fee to participate in the diabetic management programs that you have there? I understand you have programs at the hospital. Is there a fee to be paid?
Yes, there is a fee, and most insurances will accept the program. They'll also accept, through that program, you get some nutritional advice, too, on your diet, as well as educating you on the disease. It is a 3-week program. They meet once a week for 3 weeks, and we offer it every other month at the hospital.
Okay. And is it covered by insurance?
Most insurances will
cover it?
accept that. Mm-hmm.
And for the 3 weeks, what are some of the things that you cover during that 3-week management period?
It's a 3-week, and it's really a 9-hour course.
Oh.
So it's pretty intensive. They meet with our diabetic educator, soup to nuts, a little bit of history of why you have diabetes, what diabetes is, instructing on taking your blood sugars, instructing you on management of exercise, with diet, and then follow-up support.
Karen, is diabetes strictly just an acquired disease, or can it be inherited?
There is a lot of family history to diabetes.
Is there?
If you have, but we have the power to try to avert the prediabetes syndrome through, like we talked about, the exercise, the diet. I always feel like if we've done everything we can, then it is an inherited disease that we need to go forward and deal with.
Yeah. Now, I understand that you have support groups. Is the support group different than the management program, the diabetic management program that we just talked about?
Yes, good question. We do have, in fact, I'm the facilitator of both our support groups at the hospital. We offer one monthly on the first Tuesday of every month from 7 to 8, and then we offer another one on the third Monday of every month from 10:30 to 11:30. We try to make them accessible for working people, retired people, daytime, nighttime, and there is no fee for them.
Oh, free is good.
Free is good.
And typically, do people kind of self-regulate their own participation in the support group? In other words, do they stay in the support group just as long as they feel they need it, or is there a certain length of time they need to stay?
There's no prerequisite for it, no length of time. I have people that come and go. I have one of our participants is in a snowbird. She's in Florida 6 months of the year, but when she's up here, she comes to our support group. It doesn't build on itself, so you can come anytime.
Okay.
You could come to both. It's free of charge. I try to have a different topic every month to deal with. It has to deal with diabetes. So I try to make it educational as well as making a cohesiveness of people, other people who understand the disease and what you're going through.
Yeah, make it fun if
Yes.
that's possible,
Yes.
talking
and
about a disease.
I encourage caregivers to come to the support group too.
Good. Okay, now, I know this may be important to some of our viewers, but is your program in diabetes management accredited?
It is accredited. It meets all the national standards for diabetes self-management and support.
Okay. And how do people sign up?
They can access us through our website at the hospital, phoenixville.towerhealth.org.
Okay.
They can go on the website and check in on classes and events, or they can call us directly at Community Health, 610-983-1288, and one of our nurses will get back to you.
Okay. Well, great. This has been wonderful. Thank you for the public service that you've rendered in educating us about diabetes, how to prevent it, how to manage it, and hopefully some of our viewers will take advantage of the support groups.
I hope it was helpful. Thanks, Lou, for
it
having
sure
me.
is. Thank you. Well, folks, that's all the time we have for today's show. I hope that you've gained some valuable knowledge about diabetes, its causes, its symptoms, its management, and also how to prevent it, so that you can be a more well-informed healthcare consumer. Until we meet again on another For the Health of It show, I'm Lou Beccaria. It's great to be with you always. And remember, folks, if you're healthy, you're wealthy. I'll see you next time.